My name is Dr. William Drysdale. I've been a qualified medical practitioner for over 40 years. Currently, I have a strong but non-clinical association with thanksdoctor.co.uk. How to get rid of blisters. Now, what causes a blister? Well, I think we're probably all familiar with the blisters you can get on your feet if you've been wearing shoes that are too tight and you've been walking for any length of time. The other, of course, is burns, and here we'll just talk about superficial burns, maybe some scalding, or you've put the iron too near your finger. That will cause redness and the blistering effect that I've described. If they're small, they probably could just be left alone because they will resolve, the fluid will be absorbed and the blister will subside. However, some of them, particularly on the feet and ankles, can be quite large, and mechanically they will get in the way of perhaps putting your socks on and so on. Now, it is quite safe, but probably not best to do it yourself, but to have them burst or punctured. Now, your practice nurse will do this, or in A&E, if you present there, they, by using a sterile needle, will just puncture the blister, which is usually painless, and the fluid will escape. Then perhaps it would be wise to apply a mild disinfectant lotion or ointment, and then a clean gauze pad or a clean piece of tissue. It could be strapped on, hopefully to prevent the blister reoccurring, which it does, but not always. Sometimes blisters will recur, and it may be several days before you can eventually get on top of them. And perhaps if blisters do, and they occasionally can become infected by bacteria, in which case you will get some yellow purulent pus-like material that may occasionally require an antibiotic, which can be an antibiotic ointment, or sometimes in severe cases, but not very often. The main message I would give in treating blisters is hygiene and cleanliness, not to get them infected. So burst them, as I've said, probably the practice nurse is the best agent to do that. Sterile or antiseptic gauze to be applied and strapped on until the blisters subsided. That is how to treat blisters.